It's been so difficult, hearing patients complaining about the care they're receiving.
I met Kafilat and Linda on December the 15th, the first day of the nurses' strike. A month later, and nothing has changed. There is no end in sight.
I still feel dejected about the way things are going. The government is not listening. It's such a disrespect to the whole profession.
The reason why we're mostly going out on strike, I think, if you talk to people, is their concern for the quality of care that they're able to provide for the patients. And that hasn't changed either.
On Monday, ambulance workers from the Unite, Unison and GMB unions are striking in the escalating dispute over pay and staffing. And the biggest walkout in the health service's history is also looming. Nurses and ambulance staff are both set to strike on February the 6th, taking industrial action on the same day for the first time ever. NHS leaders are looking at contingency plans, but there are fears services could grind to a halt. The strikes have hit the health service and its patients hard. The latest data shows over 5,000 procedures and over 20,000 appointments have had to be postponed and rescheduled due to industrial action. And the longer the strikes drag on, well, more patients will be affected. Union leaders insist they want to negotiate, but think the government isn't interested in doing a deal to end their strike action.
Rishi Sunak, I have to say, is missing in action. I don't know where he is. And I have to say, we are concluding now that there must be a much more sinister reason for this, because this level of self-harm is unprecedented.
What do we want?
The government says it's committed to bringing down the 7 million strong waiting list. But health analysts warn that will not be possible unless this dispute is settled soon.
Unless these strikes are resolved, you're not going to see those waiting lists cleared and you're going to see a deterioration in patient access to services. I don't see a sort of digging in, playing the long game strategy working here. I think the government is going to have to look at what its options are and look at what a settlement might be.
The government has described the latest strike action as hugely disappointing, and it insists a double-digit pay rise for nurses is simply not affordable. Kafilat and Linda are worried about their patients, but also about paying their heating bills. They don't want a long, bitter dispute, but say the government has given them little choice. Ashish Joshi, Sky News.